response to 4201 Medical Drive for a 30-year-old male fallen. Timeout 1425.
All right, hey, so we got a call, we got a 30-year-old man, he just fell inside, possible broken arm, so we got a PSI on real quick, let's go get support. Are you the one that fell?
Yeah.
All right, what seems to be the problem?
I tripped over the carpet.
We got a patent airway infection in this group. All right, I don't see any massive bleeding, so based on that, quick ABC rundown, I think we're gonna go ahead and stay here and do a patient, all right? Okay,
I think I broke my arm. I slipped and fell on the carpet, and I fell with my arm stretched out, and I think I broke my arm.
Any loss of consciousness or anything like that?
No, I didn't hit my head or anything. It just hurts real bad.
Okay, I'll take over the medication.
Other than my insulin.
Okay, so you're diabetic?
Yes.
Have you been taking your medication?
I
so no
have.
loss of consciousness or anything like that? Okay, hey, why don't you go ahead and check out his arm
Yeah.
real quick, and I'll
mind
go
if I
ahead
take
and
a look
give
at
you a
your arm?
rapid
Yeah.
trauma assessment.
Okay, go ahead and hold it up right
Any
there.
softness or anything like that?
Okay, that looks pretty red and swollen. Why don't you hold that there for me?
All right.
And go ahead and splint it
I
for
have
you.
no fluid from the ears, no bowel signs, no raccoon eyes. All right, no jugular vein distension, no tracheal deviation. All right. Everything else here, fine, good. All right. And you just move your arm. So what's your pain at right now?
Probably about an 8.
All right, 8. I'm just gonna set it right there. His respiratory rate seems a little bit higher right now. I'm checking about 18 on the respirations, probably due to the fact that he's in pain. After I get this rapid trauma assessment, I'll go ahead and get an IV with some pain management on him, all right?
Okay, sounds good to me.
All right, pelvis seems intact. Legs are good.
Hey, sir,
All right.
so I'm gonna take a look at your wrist.
Got pulses.
Okay, go ahead with that. Can you hold that right there for me?
Yeah.
Okay, go ahead and hold
Got
that.
pulses. Can you wiggle? Can you feel? You can feel all this? All right.
Got pulse in his wrist.
Got
Come
a
on, go ahead
pulse.
and wiggle your fingers a little
Squeeze.
bit.
All right, good
Okay,
PMS.
what's up?
All right.
Down. Good.
No step ups on the back. All right. Okay.
Okay, go ahead and place this for you.
The trauma assessment looks good. It looks like it's just a localized injury to his right arm. We'll go ahead and get that splinted. I'm going to go ahead and get an IV started and get him some pain management. Okay. Before I do that, I'm going to go ahead and get the baseline set
Hold that right there
up.
for me for a
Can you
minute.
go ahead and get me out the BP cup and the stethoscope, please?
Absolutely.
All right, go ahead and get a baseline set vitals on this guy before we get him some pain meds. I just need you to put that on the sir.
I'm gonna keep taking a look.
How's his arm look? Pretty good?
Just get some minor swelling and bruising there. He does have full blood flow to the arm. So what I'm going to do is I'm going to just gently take this. We're going to wrap a bandage around it to keep it stuck to the board. This board's going to keep it in place so it doesn't move around, possibly irritating what we may suspect is a fracture in the right arm here. So I'm just going to go ahead and gently wrap this around you. And what we'll do is we'll get ice pack on here before too long to help with that swelling there.
All right, BP, I got like 140 over 70. I'm thinking it's a little bit high due to the fact that he's in pain, but everything else looks good. Pulse ox of 96 and an SpO2, or at a pulse rate of 96. I think it's still a little bit high because of the pain, so we'll go ahead and get that IV started. All right, hey, sorry, I just need to ask you some questions. So, are you allergic to anything?
Just penicillin.
Just penicillin? Okay, are you taking any medications besides that insulin?
No.
Okay, and you did take that today?
Yes, I did.
All right, so do you remember what happened before you fell?
I'm naturally clumsy. I was just walking through here to plug up my iPhone, and I just caught my toe on the carpet and fell.
Okay, all right.
And pulse on his wrist.
All right, sounds
You can
good.
go ahead. You can still feel that.
Yeah.
Looks like he's got a quick cap.
What was the last time you went inside? I know you're
Go ahead and hold
diabetic,
that.
so when was the last time?
I ate a small lunch. I
Okay.
ate just a chicken sandwich.
And no nausea, vomiting, anything like
No.
that? Okay, and the events leading up? Okay, so you were just walking and you just kind of tripped?
Yeah.
Okay, all right, so everything looks good on the sample history, so, and then OPQRST, so we'll go ahead and get some pain management on him, all right? So,
Sounds good. Go ahead and elevate that a little bit more for me. And then tie this
Get around you and get this IV
Side of your
and
neck.
pain meds. All right? All right, go ahead and get an IV set up, and then once I get the medication out, I'll have you give me a med check and we'll go from there.
Okay, sounds good to me. Okay, I'm just gonna tie this back around you.
Alright. Got my tubing, everything looks good, drip chamber's filled. Alright, I think we're good to go.
You got Sharps container on?
Yep, I will get a Sharps container.
Perfect. Just gonna make sure. Okay. You can still feel okay.
Everything looks good.
Check your pulse. That's good. Hey, and then IV bag. I'm gonna grab a ice pack.
Alright,
Thank you.
full gauge IV catheter. Alright. Set up.
I'm just gonna place this over
Good
the
to
wrist,
go.
not directly on the skin, but hopefully it'll help with a little bit of that swelling.
See your arm real quick. Hey, I'm gonna go ahead and give you an IV real quick. Once I get this IV set up, it's gonna be a little needle. It's gonna hurt a little bit as it goes in the arm. But once I get that set up, I'll be able to get some pain in it.
Awesome. I really need. It really hurts.
In the arm. That's awesome. Extra hands. Okay, go ahead and get this IV set up real quick.
I can get some tape torn for you.
Alright, appreciate it. Alright, so it's gonna be a little stick real quick, okay? Alright, I got a flash.
Okay.
I'm advancing the catheter. Alright, Sharps.
Who gave it away?
Sharps container. Alright, including the vein. Got my IV
How
fluid.
about parts of Hawaii and armpits?
Alright, fluid. Oh. IV line. Go ahead and start. Go ahead and start fluid. I got it flow. Check it.
Yep,
Yeah, blood
looks like
return.
it.
All right, we're good to go. All right, at this time, sir, I'm gonna go ahead and give you some pain medication, okay?
Oh, that'd be great.
And you aren't allergic to anything, correct?
No. What are you gonna give me?
I'm gonna go ahead and give you some ketamine, sir.
I've never had that before.
And you're not allergic to anything?
No. Just penicillin.
Just penicillin. Sounds good.
What's pain on a scale of 1 to 10 for that wrist for you right now?
It's hurting a little bit more now.
Okay, and is that, was there any movement that caused that, or is it just a little bit more like?
I just think it's just throbbing. It's just
Okay, and do you have any other pain anywhere else in your body? Is that just wrist right now?
just my arm.
Okay, excellent. Well, we're going to get you checked out here. This medication that we're administering, ketamine, is good medication. Okay, you might feel a little loopy on it, but it's going to take that edge or that bite away from the pain for you.
That
Alright.
would definitely be great.
I'm going to give ketamine.
Okay.
I'm going to give 1 milligram with this, which I'm going to give 50 milligrams, which is 1 cc of ketamine.
Okay, I checked that. 500 milligrams in a 10 milliliter vial. As long as you go ahead and drop 1 cc of that, it should be
Drawing 1
on
cc.
point.
Shooting air, pulling back. 1 cc of ketamine.
Okay.
1 cc of ketamine, Sharps, and I'm going to inject it directly into the IV bag and set up a ketamine drip.
Okay.
Is there a button? Slide the little button or red lever on the right?
All right.
Right?
Okay. That was 1 cc.
There we
Raise
go.
the handle, lift up, go down. Push down. One at either end. This one?
All right.
First and then
And don't
either
forget
end.
Sharps that needle.
Let go with your left hand.
In a Sharps container.
Lift up. Nose pressure.
Are you doing all right, sir?
Yeah.
All right. I'm gonna go ahead and set this to its nice slow drip rate, titrate for effect.
Okay. Doesn't look like you have any signs of infiltration on site. Looks to be nice and clear. I'm going to go ahead and get a small bandage placed over it to keep it from getting infected.
All right, sounds good. Getting everything packed up. We'll get everything loaded up in the bag. Then I'll need you to go get the stretcher. I'm gonna go ahead and get another set of vital signs on this guy.
Stethoscope and BP cuff are right here.
All right, we'll get everything cleaned up. I need to put the medication back in.
Yep. Go ahead and take medication. I'm sorry.
Gavin.
Sir, can I see your wrist, please? Thank you. We're just placing this to make sure that the site doesn't get infected.
That'll be good.
Everything's cleaned up.
Man,
What would you say on a scale of 1 to 10 your pain's feeling like right now?
well, it's been a little bit better.
All right. Gonna go ahead and get another set of vital signs on this guy.
Okay. I'm gonna start packing up the bag. I'm gonna run out to the truck and get the.
Okay. All right. I'm gonna have to give it on this arm because the other one's broken. I'm gonna give it another set of vital signs on this side.
Are we going to the hospital?
Yep, we're gonna go to the hospital, get your arm checked out, and see if it's broken or not, sir.
I think we have the Unity Hospital nearest by. Do you have any preference in medical centers you go to? Unity would be the closest location to your.
That's fine.
Okay, sounds good.
All right, BP is 132 over 76. It looks like it's getting better.
Okay.
Respiratory rate has gone down some, but real stable. I'm thinking it's because of the pain management is taking effect, so it looks like he's doing better. So I think he's ready.
Okay.
Let's go ahead and get him loaded
Sounds
up
good.
in the ambulance, and we'll go ahead and head to the hospital. I'll call medical control and see if they have anything else for us.